all, this is 1 minute solution. Today we are going to talk about iridocyclitis, that is your anterior uveitis. First we will be moving on to the definition for uveitis, and then we will be moving on to the anterior uveitis types and what are the signs that we see in anterior uveitis. Then we are moving on to the treatment. First, definition. So what is uveitis? It is an inflammation of the uveal tissues. So what are the uveal tissues we have in the eye? We have iris, we have ciliary body, and your choroid. So these are the uveal tissues, and we also get inflammation of the adjacent structures such as retina, vitreous humor, and the cornea. Next, we are going to see about anterior uveitis. It is an inflammation of the uveal tissues from your iris up to the pars plicator of the ciliary body. Now, we will be seeing the types of anterior uveitis. It is classified by Sun's classification, that is your standardization of uveitis nomenclature. First, you will be seeing about iritis, iridocyclitis, and anterior cyclitis are the three types of anterior uveitis. So iritis is nothing but the inflammation predominantly at the iris. What is iridocyclitis? It is an inflammation of the iris and the pars plicator equally. What is anterior cyclitis? That is nothing but pars plicator is predominantly involved. So iritis is mainly iris. This is iridocyclitis, both the iris as well as pars plicator. Anterior cyclitis is nothing but your pars plicator is completely involved. Now, first we are moving on to the corneal signs which are commonly seen. First is your circumcorneal congestion. So there is a congestion around your cornea. Okay, that is your circumcorneal congestion. Corneal edema, keratic precipitate will be formed. That is your proteinaceous deposit at the back of the cornea. In this, we have to remember 4 signs. That is your mutton-fat KP, that is usually seen in granulomatous iridocyclitis, and this is your 1 mark. Then the small, that is also known as granular KP. This is usually seen in non-granulomatous uveitis. Then your fine KP and your old KP. Fine KP are seen in endothelial dusting, that is at the hepatic iritis or CMV retinitis. Old KP are usually ground glass appearance. Now, next we are going to see the posterior corneal opacity. Posterior corneal opacity are usually seen when the iridocyclitis is long-standing. What is iridocyclitis? Iris plus your pars plicator of the ciliary body is going to be involved. Okay, now we are moving on to the signs of anterior chamber. So what will happen in anterior chamber? There will be a aqueous cell, aqueous flare. It is due to the leakage of protein particles. Next we will be moving on to the hypopyon. We have 3 types of hypopyon. So what is hypopyon? This is the pus collection in the anterior chamber. Okay, in anterior chamber. Now we have type 1, dense immobile hypopyon, hypopyon in Behçet syndrome, hemorrhagic hypopyon, and these are the 3 types. So usually in the aqueous flare, what we will do is we will put a beam of light, or we will pass beam of light to the eye. So what will happen? The particles will be seen in the beam of light, and that is also known as Tyndall phenomenon. Okay, Tyndall phenomenon. Now hypopyon, we have dense immobile hypopyon, that is it is usually with a high fibrin content. So what will happen? It is usually seen in acute uveitis. And if you see hypopion in Behcet syndrome, you will see it is also known as cold hypopion because it has a minimal fibrin, and therefore what will happen, if you move your head, the pus will shift to the side of the head position, and it is easily quick absorbable. And hemorrhagic are usually associated with the hepatic diseases, your trauma, and your iriditis. At last, we will be seeing a deep irregular posterior synechiae. What is posterior synechiae? That is your adhesion of iris to the anterior part of the lens. So that is known as your posterior synechiae. Now we will be seeing about iris and pupillary sign. That is your loss of normal pattern will be seen in the iris. There will be a color change in the iris, and also you can see iris nodules. That is Kopis nodules, and that is at the pupillary border. And one more nodule, that is your Basaka nodules or near the collarette. Okay, so these are the two things, and the most common is your Kopis spots, Kopis nodules. That is at your pupillary border, and it also initiate the posterior synechiae. Okay. Next, you will see a annular posterior synechiae, that is your ring synechiae. What you will see here is there is a 360-degree adhesion of the pupillary margin to the anterior capsule of the lens. So on all sides it will be attached the anterior capsule to the anterior capsule of the lens. So that is called as ring synechiae. And you will also have a aqueous collection is more push of the iris forward, and that causes iris bombae formation. So aqueous will be produced more, so there will be a push of iris, and that is called as iris bombae. And neovascularization of iris, that is your rubeosis iridis. This rubeosis iridis will be formed only in the chronic iridocyclitis. Okay, chronic iridocyclitis. So these are the signs. Now we will be moving on to the complication and investigation. First is your complication is complicated cataract, secondary glaucoma, papillitis, choroiditis, band-shaped keratopathy, and thesis bulbi. So what is thesis bulbi? It is nothing but the final end stage where it is a form of chronic uveitis. So thesis bulbi are usually seen with the end result of the chronic uveitis, where the eye become soft and shrunk, and you will be having atropic. And there is a development of thesis bulbi in 3 stages, which you will be studying in the detail of the complications. Investigation, you will do TLC, DLC, ESR, blood sugar level, serology, urine and stool examination, radiology, CT and MRI scan can be done for the investigation. Okay. Now we will be moving on to the treatment. So treatment, we have cycloplegic drug, corticosteroid. These are non-specific treatment. Okay. So cycloplegic drug, corticosteroid, immunosuppressive drugs. And what are the physical measures you will do? You will use hot fermentation and goggles. Okay, and we have to treat according to the cause. So this is all about the anterior uveitis. Thank you.